we do the cycling test to make sure the device functions during artificial sphincter. We irrigate saline into a closed space, and water does not pass through the pore, and we may observe slight blanching of mucosa. This means complete coaptation. Complete closure is an integral part of artificial sphincter, and every surgeon should make sure the complete closure prior to finish of the surgery. We also check the caliber. However, the opening degree of subcup urethra is various from patient to patient. So there might be a concern that the small opening of subcup urethra might aggravate the surgical outcome of artificial sphincter. However, there is little information available. So we have investigated whether the opening degree observed during the cycling test might predict the outcome of artificial sphincter. We have excluded urogenic incontinence and the patient who have experienced traumatic urethral erosion. On a constant resolution image, we have delineated actual opened area. And then we have delineated imaginary circle, which have the same diameter as the longest length, end-to-end length of the actual opened area. The opening degree was defined as a value obtained by the pixel number of actual opened area divided by the pixel number of imaginary circle. The correlation of opening degree and LUTS scores was evaluated during the annual outpatient follow-up. A total of 128 patients were included. The median opening degree was about 60%. 21 patients experienced immediate urinary retention. However, there was no significant difference in opening degree. Just 4 patients experienced non-traumatic urethral erosional atrophy. The absolute median value of opening degree was smaller in atrophy group. However, there was no significance in statistics. Regarding the voiding symptoms, we could not observe significant negative correlation in any item of voiding symptoms. From this result, we might suggest that the incomplete opening of subcup urethra is not associated with aggravated voiding dysfunction. Paradoxically, in storage symptoms, we could observe some positive correlation. However, the items which have positive correlation is not consistent and vary from year to year. And furthermore, in every case, we have confirmed the complete coaptation. So we might suggest with care that the positive correlations observed here might not be significant in clinics. Therefore, we might conclude that, contrary to general concern, the incomplete opening of subcup urethra is not associated voiding dysfunction after artificial sphincter. However, regarding the erosion and atrophy, further study with more large number of patients might be required. Thank you.
Questions from the audience? How many times did you do this measurement? Every year?
Yes, every year.
I mean the measurement of the circumference, etc.
Do you mean the circumference? During the surgery, second test.
Yes, but did you repeat that?
No. Do you mean intraoperative procedure?
Yes.
Yes, we do the several times, open and close, and yes, about 5 times in average. Yes.
Do you think that if you repeat that after 1 year, for instance, because you can do it also in the outpatient clinic?
Yes. Outpatient clinic intraoperative cycling test was not performed. We just consider intraoperative cycling test.
Okay. Do you think that it will change over time?
Yes, we think from our research, the pattern of the significance or positive or negative, even though without significant in statistics, there might be some change in patterns. Yes.
Okay, thank you. Chuck?
Just a simple question. I assume that the height of your water column was standardized. It was always the same. The height of the water column,
Yes, water pressure is set the same.
which is what?
We set the water pressure about 80.
No, but
centimeters.
at what height did you put your bag, your water bag, compared to the height
Yes,
to the patient?
From
the
the
patient.
level of symphysis pubis to the highest level inside the water bag and fluid bag. So we check the length.
80 centimeters.
Yes, about 80 centimeters.
Okay, thank you very much.
Thank you.
We continue with the next presentation.